All right, well, hello, Community Action. We're going to go ahead and get started. My name is Denise Harlow. I'm the CEO of the National Community Action Partnership, and I will say we are recording today's webinar. We are at a point in our nation's history and our world's history that we have not seen before. It is a challenging time personally, professionally, as a community citizen, and just so you know, we so appreciate all that you're doing across this country. We know that community action agencies, state associations, state DSBG offices are really working hard to figure out how we continue to provide such critical services to families across America in urban, rural, and suburban communities. So first, thank you for everything that you're doing. And we had a great response to today's webinar for people, the number of people who wanted to register today to talk about communication strategies in this time of crisis. This isn't, someone framed it as almost a hurricane hitting the entire country, or in this case, the entire world in a lot of ways. And so while we have a lot of times a crisis communication strategy or even a disaster preparedness plan, and many of those components are going into place and we're deploying those plans and we're looking at our crisis communication planning. It doesn't always apply to everything that's going on today. And many agencies haven't had a chance to develop those tools and resources. So today we've put together a webinar that we hope will provide you with both some subject matter experts, both from a consultant perspective, as well as your peers and colleagues in community action from around the country. We're joined by Ketayoun Darvich-Kodjouri, who has been working with the partnership now for several years on communications, helped us with our impact report, has done a number of webinars with us, so we're thrilled that Ketayoun has continued to work with us. And then we have 3 executive directors who we've been seeing very visibly on social media and other ways that are able to communicate and are in constant communication with their communities on the current crisis, how their agencies are responding, and doing it in a way that we think is very relevant, very hands-on, and knowing all 3 of these women have a lot that we can borrow and steal from as well. So Katrina Bowman-Thomas will be with us from Northern Kentucky Community Action in Covington, Kentucky. Connie Stottlemyre from the Community Action Incorporated in Topeka, Kansas. And Sharon Price, the Executive Director of the Community Action Council in Lexington, Kentucky. If you don't follow those agencies on Facebook or Twitter or whatever, I encourage you to follow them. It's great to see some of the cool stuff, and I know I steal ideas, and I hope that you will be able to borrow and or steal ideas from these agencies. We do want you to participate in today's webinar if at all possible. You will see on the right-hand side of your screen, down below maybe the list of your name or attendees, there'll be a little hand. We're going to attempt, if you raise your hand, to unmute you at some points during today's webinar. So if you want to be unmuted to ask a question, please do that. But you will have had to have logged in here on the web, and we have to have your voice tied to your name. So you'll know that if we're unable to mute you. We also have the chat window, and I encourage you to put in your questions, your concerns, and we will be sorting through that during today's webinar and pausing periodically because, again, we want to make this a conversation. I know Ketayoun will be dialoguing with our 3 CAP Executive Director experts here to tease out what we think will be the critical elements for you as local agencies, state associations, and state offices to be thinking about as we go through these next few months, if not longer. We have a long road ahead of us, and we need to be ready. So with that, I'm going to turn it over to you, Ketayoun. And again, thank you so much for joining us here today.
Thanks so much, Denise. So Denise and Javita and her team and I spoke a bit ago to talk about the COVID crisis and what that might mean around communications. And working with her team, I think I've met many of you previously at some of your conferences to talk about how to do crisis communications planning. And in a scenario where you have time to think ahead, right, I often talk about preparing, planning, and then putting a plan into place. And we've certainly skipped to step 3 here. and, you know, really thinking about with the crisis hitting, what is it that you all could be thinking about right now and putting into place right now in order to make sure that you're able to engage the community, communicate with your clients, talk with your staff. And so, you know, I think originally I talked about sort of some top 10 tips, and realizing that in this particular moment in time, one of the most important things that you can do is to be frequent and brief. We've taken it down to 5, and here are the 5 things that I think everyone should really be thinking about. So one is to really think about and we're going to go through these individually in just a bit, but really think about who your crisis team is, who you're pulling together. Think very carefully about who needs to hear from you, what it is that you're communicating, and why, actually, how you're doing that, and what are your messages. Like in many ways, those are the 5 key things that you should pull together very quickly in terms of a plan right now, that shouldn't take a lot of bandwidth, that would allow you to kind of keep your signal moving forward in the way that you want to. And so I would encourage you all to take a deep breath, and if you haven't already, to put those sort of 5 elements into a sort of a mini sketch of a plan, so that every day you can be moving forward in terms of communications during this time. So I think one of the things to remember, as Denise was saying, is a lot of times with crisis communications, we're talking about an organization in crisis or an organization dealing with a localized crisis. But here, the entire nation, in fact, the whole world is in crisis. And so I think it's also extraordinarily important for you to remember that you have a role to play and you have meaning to make in this time, that you're kind of swimming in a much larger ecosystem than typically in a crisis situation. And so one of the things that I'm talking to a lot of folks about is to be very mindful in terms of your kind of role in the larger crisis, this unveiling and understanding that every person on your staff, every member of your community is dealing with a crisis in a way that that involves them having to turn to many, many people and not just your organization during this time. So I just wanted to put that context out there, because sometimes we are at the center of the crisis, and here everyone is. And so I'm going to walk through some of these things, but I think we should always be keeping in mind all the other sort of factors that are happening as people are being kind of bombarded with messages right now. So let's just talk about your crisis team, if I could. So typically, when there's a crisis, you want to have a crisis communications team. And I think now you want to really think about who those folks are that you're touching base with regularly to figure out what information you're getting out there and who's getting it out. So sometimes you may have a communications person on staff, and many of you do not. But in addition to the communications person, whoever has that responsibility, obviously you want to think about the legal risks and ramifications for any of the communications that you're putting out. So it's super important that you have someone who has their legal hat on, both to interpret legal guidance that's coming your way and to make sure that you're not creating any legal risks from your communication. So that's one thing I want to just flag for everybody and remind you. In this time, like many, the legal side is important. You want to have, obviously, management folks. And another thing that I want to point out is sometimes in a crisis like this, it's super helpful. You want to keep the team small, but you want to make sure you have a variety of perspectives. So to the extent that your smaller team may be enriched by having somebody that brings a different kind of perspective, I think that would be really helpful. I'll give you an example. I'm working with a group right now, and the folks on their smaller team are very matter of fact. They're really thinking about, okay, how do we get information out? How do we minimize risk? How do we get clear about programs, and what are we stopping? What are we starting? They were a little bit blind to just the overwhelming anxiety and mental health needs, and the notion of really promoting ideas of care and being caring. And so one of the things that I advise them to do is to bring someone, even though they wouldn't be typically part of that small team on who had a lot more of that perspective of the emotional health. And by bringing that person onto their team, their communication started to reflect a lot more about, concern and reassurance about the sort of well-being, emotional well-being of their staff and their external partners. And so I just want to say, again, just like take a moment to think about the blind spot or that team, if they all have a very similar kind of way of communicating, you might want to think about bringing someone who might reflect a value that you want to make sure you have on that team. So think about the crisis team. Get very clear about how you're staying connected. Some of you are shut down at this time, and there's also lots and lots and lots of bandwidth issues. We're finding that, with multiple, so many people having video calls, students at home, there's lots and lots of issues around bandwidth. So think about how you are staying connected. I think phone calls are just fine. So don't feel like you always have to transfer to this new, the web streaming or the video streaming. And then be really clear about how often you're talking. So some teams I know around the communications are talking twice a day, sort of at the beginning of the day, at the end of the day. Some folks are talking once a day, but really be clear about what your expectation is around how you will stay connected. So again, just sort of pull that team together. It may be a little bit different than your team who's dealing with the overall crisis, but you want to have that team pulled together. Okay, next slide. And then I want to just remind you all that you're communicating with a lot of different audiences, and that one size doesn't necessarily fit all in this circumstance, right? So one of the most important things to do is really think about the staff and what their communications needs are from you at this time. I think, who was telling me that they have a weekly video call with their staff? One of the presenters was saying that.
We do.
You are, a number of you are, yeah. The staff need to be reassured, and we'll talk a little bit about some of the things to communicate with the staff. But staff have a very specific need from you. Your community members who may or may not be clients, right? If you're a trusted local resource who may be able to point folks to different ways of accessing the information that they need, your clients. I think if you feel that your governor or your mayor or whomever, if you have needs that need to get filled, don't forget about keeping them in your loop of communications at this time, and then obviously also your donors. Now, in a sensitive way, now is a really important time to let your donors know that you are experiencing even higher need, and that they can actually step up and help you at this time. So
can I make a comment?
Say it again.
Hey, no, I was just going to add a quick comment about the policymakers.
Yes.
So Sharon and I both are in Kentucky, and we talk pretty regularly. And so one day I was talking to Sharon, and she said, well, I'm emailing the governor every day. So every day she's sending the governor an email because our governor goes on every day at 5 o'clock and, addresses the state. And she's like, I'm sending my daily email. So just to reiterate, when you're talking about the audience, that we do need to reach out to all aspects of, because everybody is touched and involved with this issue.
Absolutely, and that's terrific to hear. And I also want to say that there's a PR agency called Edelman. It's one of the national PR agencies, and they do a regular trust barometer. So Edelman always does a scan of the public and asks, like, who do you trust most? And they're usually like looking at the media, they're looking at nonprofits, they're looking at the government. And they just released yesterday or the day before a trust barometer in this crisis. And you know what the number one most trusted group is at this particular moment in time? It's employers. Can you believe it? It's employers. Because people are getting bombarded right now with so much information and disinformation they feel that employers are giving straight information, are keeping the well-being at their staff front and center. And I found that really a terrific finding. And so I want you all to know the power that you have right now as employers. There is also a high set of expectations on employers right now. And so not just for staff, but for your community and for others, remember, you're a powerful force that's trusted just because you're employers and you're keeping the lights on in a very difficult time. So I want you to know you have an added element of trust right now in this crisis, that Americans are seeing employers as the most trusted source of information right now. Let's go to the next slide. Great. Okay. So again, really think about, in this particular moment, when people are being bombarded with information, what kind of information are you sharing? What is necessary? And focus on what I'm calling meaning making, right? Like focus on information that is valuable and that only you can provide or reinforce based on your position in the community and as employers right now, right? So obviously, as agencies that really support your communities, there's a lot of just straight up information that you are communicating out to the public. So, and you should be doing that regularly and through multiple channels. So your offices are closed, where people can get services, your shifts and hours, how to keep updated, how to reach you, all of that basic information about whether your doors are open or not, or how to access services from you and what your what's available through you at this moment in time. That should, in a lot of ways, that and the HR information should be your number one priority right now. And that should be done in multiple channels and consistently. And especially if there's a change, communicating that change and then being consistent about that. There's so much information that the staff are looking for you toward, you know, a whole range of things from the telecommuting policy to sick leave, how they can practice self-care, how they can access mental health resources, your kind of compliance. You know, there's a ton of information. And I would say I'm going to add to the staff this notion of, you know, your boards or your donors or your supporters. I was mentioning to some of the presenters that I was on a board call today and with an organization that I'm involved in. And one of the things that CEO did and has been doing is been giving us very regular updates about how they're prioritizing their work right now. And I think that's one piece of information you all should be thinking about for your staff and for your board and for your volunteers. How are you prioritizing and what are you prioritizing? And I am reading from this that the CEO sent me, and it both served as a factual basis and also to reinforce the values that organization holds during this time. So, you know, employee safety and well-being was the number one priority that she wanted us all to know that they are prioritizing. You know, lots of other things, but I thought another really important thing that she talked about was focusing on marginalized communities was their priority at this moment in time. So I think that every communication with your staff, sometimes we think about staff and we think we want them to be safe, we want them to be well, but we also just want to give them, you know, what they need to know to do their work. But if this is a real time for you to continue to share your values with your staff and to let them know that we're all in this together, right? So I don't want you to sort of forget about that in the crisis and the hurry of trying to do these other things. You're also a trusted community resource. So, you know, are you a place where people are turning to really understand where they can get food, where they can get rental assistance, et cetera? You know, again, I think how to help. I'm finding that folks are really looking, okay, their first priority is like, am I safe? Is my family safe? How am I going to homeschool? How am I going to do these things? When they have that extra bit of capacity, they want to alleviate their anxiety by feeling like they're being helpful in a really chaotic time. you're a wonderful place for folks to turn and to be helpful, right? Whether it's in kind or monetary donations. So I don't want you to be afraid right now to say, if you're looking for a way to help right now, here's what we need. Because folks are looking for something to do that makes them feel like they're contributing to a solution. And then I don't know whether you are helping to support the public health information that's getting out there, but I would say that we all have a role right now in kind of reinforcing the sort of science-based public health information that our states in particular are getting out there. So again, these are just some examples of things that I would really think about in this really chaotic, anxiety-inducing time when people are being bombarded with information. You can play a role in providing meaning and providing sort of action for people. So you're not reinforcing anxiety, but you're sharing information. Here's where you can go. Here's what you can do. Here's what we're asking of you. Here's how you can stay safe, right? Be really purposeful and focus on sort of making meaning. Does that make sense? Okay. So the how are we communicating, I just want to say it's all the channels that you typically use, but I would really think about using multiple modalities right now to reach everyone as best as you can. So if you have phone trees, if you have recorded text, SMS, or phone messages that you leave for folks, now's the time to deploy those. Sometimes people get, in other times, people can't stand getting all those phone messages. But this is the time where that's helpful. So you could even say, we're setting up a Sunday evening or a Monday morning phone calls. And so get added now or text messages. And so we're going to just let you know, you're going to hear from us every week at this time with the latest information about closures or shifting schedules or whatever. You can set that up now. Email, I think, is super important. Again, people are going on social media and then checking out of social media because they're getting overwhelmed with information. So if you have your email list, now is the time to really use your email list and to, again, be consistent, factual, focus on valuable information. So I wouldn't communicate just to communicate, like give them factual information. I'm seeing all sorts of great uses of social media from these panels and these panelists, and so I'm excited to hear about that. I think, and then with traditional media, I just wanted to point out, now is the time when a lot of your local reporters are looking at creating lists and of where people can turn for resources, and also where people can turn to donate if they want to help out. So I would be connecting with all of your local media, with both the print and the TV reporters, so that you get your agency's information put on that list that they're sharing with the public around where people can do donations and where they can turn for services. Next slide.
Somebody put in the chat window about your conversations with staff and talking about the emotional support and encouragement for staff. So that seemed to resonate with some folks as well.
Yeah, absolutely. And in fact, if you all have employee assistance programs, like some health insurance companies have that, now would be the time to remind staff that, like, in addition to just the fact that you should, take breaks and go on walks and take care of your emotional health, we actually have an employee assistance program. And just a reminder that here's the number. So if you're feeling particularly stressed out, like, please reach out. We do have those resources. So remind folks about their mental health coverage. Okay, so quickly around the messaging. So be mindful of the context, right? I keep saying this because I think everyone is experiencing this crisis. So we're not the only one. So be caring and be mindful, be clear. Now's the time to be brief, focus on facts, be clear, be calm, offer perspective, really focus on those how, what, why, and wheres. Be transparent, right? So by that I mean if you don't know an answer, don't give an answer. And in addition to that, I love it. Someone mentioned that I'm touching my face. I know I'm a big face toucher. So I'm modeling good public health information. My hands are clean though, I have to say. So be transparent also about if you say you're going to get back to things or you're going to put information up at a certain time, make sure that you do that, or make sure you put up a message that says you're not able to do that because things are shifting and you're going to do it another time. So the transparency, because you have trust right now, so much trust, keep that trust. I keep talking about the meaning making. Folks are really looking for a way. I keep getting all these texts about how anxious everyone is. And the way to help deal with anxiety, right, is to give folks things that they feel like they can control, that they can do. You are the perfect agencies to do that. And then be mindful that safety and well-being should be the front and center of all of your messaging right now.
Interesting that you mentioned texting, Ketayoun. Someone is asking about, do you have any recommendations of apps or services that could potentially be used for texting that isn't really super expensive for local agencies?
I can follow up and we can share some of those resources. There are just a ton of them right now. So, but we can follow up and share some of that.
Someone just put in the chat, Call Hub might be an option too. So we'll try to collect some of this stuff too and put it back out to everyone who is registered today as well. Great.
So I know we want to hear from the other folks on the panel and then have a bigger discussion, but are there any burning questions that folks have before we look at some of this in practice?
There was somebody who did raise their hands. Danny, I'm going to go ahead and unmute you here if I can figure that out. Hold on. Someone also suggested Slack as an option.
Slack, yes, for teams.
Mm-hmm.
Absolutely.
Okay. Danny, you're unmuted if you want to ask your question. Going once. I'm going to remute you. Chat me if you want to chat. Deborah, I'm going to unmute you next. Maybe. All other duties is assigned. That's all I have to say. So, all right, Deborah, you're unmuted. Go ahead. You may need to unmute on your side, Deborah. Going once.
It's hard with 650 people. Maybe
it is. It is. Let me go through the chat window here. There were some chats.
Lots of good suggestions of texting features that folks are using that are working for them. So that's great. I guess some of these, make sure, if you have other resources you want to recommend, I'm going to recommend that you send it to all participants. But a few that came to the panelists, Microsoft Messaging, let's see, Child Plus texting feature, pros and cons, but it's a resource. Okay. If you want to say what the pros, Tawny, if you want to say what the pros and cons are, feel free to put them in the chat.
Question about social media. How many posts would you recommend in a day or over the course of a week?
So I would say this: what is it that you're sharing, and how urgent is that? So the general rule of thumb I would say is for I would also look at your audience size, but Facebook and Instagram audiences don't like a lot of posts there compared to Twitter. You could tweet all day long, constantly, and you won't tire people of your information. So typically people are tweeting a lot more than they are putting posts on Facebook and on Instagram and other platforms. Having said that, if you have something to share I would share it. So I would think about sort of at least once daily on Facebook right now, sharing information that's relevant and useful for folks. If you have, if you have information to share, or if you want to do some sort of daily live stream on Facebook, Facebook Live, I think there's lots of ways that you can use that creatively. You can be doing storytelling. If you have all of your child care programs, I'm seeing a lot of folks sort of doing reading and, just sort of trying to keep the community together. And if you're going to do something like that, I would always do it at the same time every day so that folks can expect it. So it's 1 o'clock every day or 11 a.m. every day. You're going to be having someone read a book on Facebook, or you're going to be doing something of that sort. So that you would want to do consistently. But otherwise, it's always sort of, to me, it depends on what you have to share and whether it's valuable, right? I wouldn't be posting things just to post things right now. I think it's totally okay to sort of take a deep breath and think about what's the most important thing for you to share right now. Does that make sense?
We're going to try one more unmute, and then we'll move on to the next panelist. How does that sound?
Sure.
So Deborah Frieza, I'm going to unmute you. You are unmuted on our end if you'd like to ask your question. From CETA, Chicago. You may be muted on your. Go ahead.
I don't have any question. I was having some technical difficulties with my laptop.
Okay, never mind then. Thank you.
All right, thanks.
All right, let's go on to Katrina. I just want to preface that. Just if you follow Katrina on Facebook, the Northern Kentucky Community Action Council, you will see a new commercial that they just recently launched, or a new video. I know she'll be chatting here a little bit about the work that she's doing. So, Katrina, why don't we turn the ball over to you here?
Sure, yeah. Thank you so much for allowing me to be on here. As we've said, it's crazy times, and I think one thing that really worked well for us, we, I guess when I first came here about 2 years ago, we really sat down and developed a communication plan, marketing plan, and we decided, what we wanted our message to be, what we wanted the tone of that message to be. We have one in-house person, Rhonda Chisenhouse. She's a VP for community development. And then we worked with a consulting group that helped us to really think about our message. We had a lot of messaging that went to our participants, but we also wanted to create a message to the business community, really to be partners with us. So we sort of had that as a basis already for our communication. So when this crisis struck, we have a crisis team that consists of our executive team, and then we have 2 frontline managers, and we really sat down to say, what do we want our message to be, to our staff, to the families, and then to the community at large, as well as the board, and then all of our local officials and the business community. And so one common thread that we wanted to make sure was consistent throughout all of our messaging is that if we are steady, we're consistent. We have been here for over 50 years, providing these services to families in crisis, that this is not something new that we're dealing with. But when you're looking at, our society today, and I think someone already mentioned it, everybody is sort of on high alert. It's like they're constantly on 10. So every time I go onto a video chat, I'm very clear about the tone that I have with my staff. I have a very consistent, even tone with them throughout the entire communication. And as you said too, even with my message to the staff, it's first and foremost your health and safety. So we talk about the CDC guidelines, we talk about what the governor is doing. We talk about all of those things first before we get into what's going on operationally with our organization. So I don't want to hog up the time because, I can talk forever. But that's, that's just sort of, and again, with our staff, we do the video. Then with our participants, we made sure that all of our messaging was done by our VP for community development. We said nobody send out any messages to anybody until you get the message from us. So we updated all of our messaging. She did all of that. We updated all of our phone messages, every message on every social media channel, so that it's clear what we're doing right now. And then I send, communication out to my board, and I've reached out to all of our judge executives, everybody. Our message is we are still here. We've been here. We know what to do in a time of crisis, and we will help our community through this, and we know that we'll get through this together.
That's great.
Thanks, Katrina. Appreciate that. We'll definitely be circling back and posing some questions to you to dive a little bit deeper. I will ask that if everyone could put their chats into all panelists, that would be great. That way all the panelists can see all of the questions, and we'll circle back to them as we go forward as well. I want to turn the tables over now to Tawny Stottlemyre. Tawny was with the Kansas State Association for a number of years and is now the executive director, and has been now for a number of years at Community Action Incorporated in Topeka, Kansas, and serves as a commissioner on our CCAP commission. And you're seeing right here on her Facebook post, those are huggy heart face masks. So Tawny, we look forward to your remarks. Thank you for being with us.
Oh, thanks. I'm delighted to be here. I probably feel like a lot of you that we're just doing what we can to make this work. And that, the first time somebody asked me, well, what is your pandemic plan for the agency? I just laughed out loud because who has a pandemic plan for their agency? But we do have some communication plans in place. And I think that it's been such an educational moment to know that that planning pays off.
Yeah.
And so being able to follow those plans in the time of crisis is another story, but having them in place is really helpful. We sat down with the executive team and first outlined our priorities and goals immediately, and came to a really quick conclusion that our goals were, first and foremost, to help lower income customers deal with this emotionally and economically. I mean, that's what we're here for as an organization, and to keep a hold of our mission, not to let ourselves get dragged into other crises or other opportunities, but to stay firm with that. And then our second goal that we really wanted to get out there and have it stated was keep staff economically whole and safe. And for us, that went to addressing what Ketayoun was talking about in just hitting the emotional side of it and making sure that we understand we're all realizing this experience together. And to over-communicate, that was our third goal. Because where there is a lack of communication, people will fill in their own blanks. And so we don't want that happening about how to stay safe at this time. We don't want that happening with our staff at this time or our donors. So we just really set that goal of over communicating. But Katrina, like you, we wanted to make sure that those messages were controlled and followed those guidelines. So communication is coming through a very short list of our leadership team members who know these goals and understand our guidelines. As a very quick example, we don't make a social media post without the hashtag #BeCommunityAction at the end. And that's not really having anything to do with this crisis, but those are one of the restrictions that we put on place of our communications in terms of these are things you got to know if you're going to communicate on behalf of our organization. So our communication follows a 3-pronged triangle, something I learned in, ancient crisis communications classes that I took a long time ago, but it's really always served me well to know what my 3 key messages are and to be able to communicate those messages each in 2 or 3 different sentences, but to always make sure that at least one of those messages is getting out at any given time. So the first part of that is the caring and empathetic side, that this is a situation that we're all going through, and it's something that's uncharted, but that's how we work as a community, is to deal with challenges together. Our second message is community action is here for you. We're open. Like Katrina was saying, we're steady. We're going to continue to be here, and we'll be a rock at this point, whether you're an employee, a board member, a donor, or a customer. And our third message is one that I think is really important during times of crisis. Let's do this together. And that's a harder one for us to communicate as nonprofits, because we're so used to having territory and doing things with separate pots of money. So that's one that I'm really trying to over communicate to a broad audience. So those are our 3 communication messages. And then I think the last thing that I really wanted to share was it's an earned media opportunity in some ways that we need to take advantage of, and that's where the Huggy Heart masks come in. I'm so tired of people saying they don't know who community action is or they don't know what we do. And so I take advantage of every opportunity we can to get ourselves out there and to brand. And so we happen, I see a question in the box about how can we get the Huggy Heart face masks. I had them specially made by a former employee, and we also have curtains out of this material in one of our offices. So so they're not marketed at this point, and I probably would never do that, but just being able to make sure that the community action brand is getting out there and seen with these messages, I think, is important. This was also a really big morale booster for the staff and volunteers.
Mm-hmm.
Great. And given the hard it is to get a mask, just to get a mask. Might be
yeah.
good
Yeah.
for staff.
They
Yeah.
smell a little funny, but, wash them and you got it taken care of.
There you go. And I did see someone else said that they're using the hashtag Community Action Responds in Ohio. So that's also a good one. We probably need to give some more thought to something like that for the network as well. And so thank you. We'll certainly circle back. Turn it over here to Sharon. Sharon has taken the reins in Lexington and has gotten this organization humming and running along. So Sharon, have really been impressed with what I've seen on social media, both prior to and now during the crisis. You are giving video updates. You are consistently out there. You as a leader. So look forward to your comments.
Thank you, Denise, and I'm glad to be here just to share with you guys today some of the things that we're doing at Community Action. I won't rehash any of the things that Katrina or Tani have already said, because we're basically doing the same type thing. We may have a little bit of different flavor to it, but typically along the same lines of being community action and being that voice in the community. And so I, like you guys, did not have COVID-19 in any of my disaster preparedness plans. That is not what I was prepared for. But taking a look around the world and being aware of what's going on in our neighborhoods, in our communities, in our state and nationally and across the globe gives us a pretty good indicator of what we can start preparing for. So the conversation started for us and our organization, a few weeks before, the big thing hit. And so taking a look at how are we going to message this. And so we too have a great and dynamic communications team who takes care of all of our communications and blesses everything that we do. But also being aware that the people that are in our community, we've already talked about the messaging is different for different people. We have 5 Head Start programs. So we have about 400 staff and 3,000 children spread out across 17 different counties. And so the largest majority of the people that visit our Facebook page and that we've targeted are going to be our parents. And so we know going in that our parents have different literacy skills and abilities. And everybody is not going to be able to read a long message that you have. And so to put some of these things on video so that they can click and easily see, and keeping those videos to, a minimum. And so some of the things that we've addressed, and basically we received the information directly that was coming in through our call centers. So what are people calling and what are their concerns? What are their fears? What are their needs? And addressing those things immediately. food insecurity was one of the very first calls. I'm sure that all of you guys across the nation received those calls as well. And so we operate a God's Pantry in one of our locations. So to make sure, one, that when I'm addressing our parents, I've been addressing them as a parent. I want the parents to know that I feel what you feel, the same fears that you have for your family, I have those same for me. And, you know, putting their minds at ease, number one, empathizing, and then telling them what to do, what needs to happen. You know, that seems to be working for us. The food pantry, we went from seeing 20 people, 22 people a day to seeing 160 in a day. And so, you know, those are big numbers. And, you know, just making sure that our families, you know where they can go for help. And I'm going to share another story with you, Denise, and it's actually about the safe video. I'm going to tell you guys, above all the things that we do in every aspect of our job every single day, being there and being community action, part of being community action, and the main thing is keeping people safe and making sure, because our families were not prepared for school to end, for them to get a notification saying, okay, on Friday, this is your last day. Monday, you won't be coming back until, you know, April 20th, if you come back at all. And so this means that we know what happens when routines are off schedule, right? You're preparing for your child to be somewhere else during the day. You don't plan for your child to be there. You know, you're planning to go to work, everything will be fine. We put it together, a safety video, to remind people of what are some of the things that they need to be aware of in their environment, and things that could, everyday things that could cause your child harm, even from the cleaning supplies all the way down to weapons, and making sure that those things are put away and stored away. There's no need for a child to be harmed while we're trying to work our way through COVID-19. And to be just quite honest with you guys, one of our children were harmed due to not being in school. And so we want to make sure that we can get the message out to other people, because we don't want COVID-19 to turn into something devastating at the present, if our children are not safe at all. And just giving parents that reassuring, hey, I'm with you. I'm a mom. I have 4 kids. And these are some of the things that they did when they were growing up. And so I just want you to be more careful, you know, and that kind of thing. And just getting that message out there and talking about that. And then letting it sit. Someone asked about how many times do you post a day. If it's something important, you let that message sit. You don't post it, you know, load your Facebook page or your social media where you're pushing the important message down. Important messages need to sit there for a day or two so that it gets more visits and likes and seen, so that you know that you're being impactful in your community. And so everything that everybody else said, you know, is true for us, but being intentional and responding to and predicting what is going to be going on in your community and what people might be concerned about, and then responding to it in the spirit of community action, because that's what we do, right, Denise? Helping people change lives, that's what we do. And that's the spirit of community action. And I've seen it all across our communities, all across the state, the country, where people are coming in and changing their communication. And let me tell you, if you see something that we've posted and it's going to benefit you, you don't have to borrow it, just take it. Just feel it. You don't have to be shameful about that. If somebody else has something that works perfectly, just borrow it and go on. Because I think we're all in this together, and the more we work together, you know, even with the communication, before we started talking, we were sharing, and Katrina and I talked about how we share things. We don't work at the same agency anymore, but if she's written a policy that I need, she shared that with me. There's no need for me to spend time doing that when we can work as a team and talk through the different strategies that we're using, and especially during communication. Having phone calls with staff, weekly phone calls. And I can tell you, if the staff trust you and they believe in you, you can tell them, I don't know the answer to this, and they're going to support you anyway. But you just being honest and upfront and having open and constant communication that's predictable, that they can rely on. So talking a lot, but talking differently to the different audiences. That's what we've been doing.
Sharon, before you wrap up, there was one specific question for you, which was, what is it that you're communicating to the governor So I just wanted to make sure that you let people know what is it? What is it that you're saying to the governor every day?
So I'm just trying to help him do his job because it's a big job. So I'm just trying to help him along. So a couple of weeks ago, one of our counties was the first county in Kentucky to have a confirmed case of COVID-19. And so that hit home. And so now I need to communicate with all the judge executives and get in touch with the governor. I need to make sure that our staff and our operations, and not just for us, but for our community mom and pop daycares, because this isn't just about us and what we do. This is about our entire community. And so my very first correspondence with him was about continuing to pay the child care subsidy in light of the center closures, because if we stop paying those, community action, Lexington is going to be okay if they stop paying that. Mom and pop daycares that have 20 or 40 kids in it, those centers are not going to be okay. So looking out and being a good neighbor. So I just had to send him saying, hey, we need these payments to continue, you know. So just different things like that. And so he got up and he announced that child care subsidy was going to continue. And not maybe just by, I'm sure I wasn't the only one, but topics that affect low-income folks or people that have never used our services before that are going to need them in the future. We got to be thinking about them too. So I do send him messages, not every day, as Katrina stated, but every other time. They're just topics that need to be on the top of his radar.
And I think, and I mentioned that with Sharon and the governor to say that I think that, and I saw someone say that now is really our time, and I think we shouldn't be afraid to reach out to whomever we need to reach out to. All of the judge executives, everybody in our community that has any type of influence, we should be reaching out to them and saying, hey, we're community action, we're here, this is what we're needing in the community. She talked about the media earlier. I've reached out to local media and said, hey, this is what we're doing. Will you feature us? Different news channels are picking us up, and they're talking about our stories. We're still putting it out. We are urban and rural, so we're putting our story out in the newspapers because in the rural counties, a lot of people still depend on those newspapers. So, the sky is the limit. Talk to whomever you talk to. Don't let me get a line to Trump. Don't let me get a line to the president. I need to talk to the president about personally. I just don't know how to get there. But don't be afraid. Talk to whomever you need to, because we really are the heartbeat of our communities. We hear from our families directly what they need, and we have to be the ones to champion that voice to say this is what is really, truly needed.
And Katrina, it's okay to be afraid to reach out to those people.
It is.
But reach out to those people anyway. Anyway. I was on the phone with Katrina. I said, I'm writing this letter. Make sure I'm straight. You know? And so just even if you're afraid, that's what community action and being a part of community action doesn't mean that you're not afraid or you're always brave and bold. It means moving forward in spite of that fear. And so even if you're afraid, do it anyway. Yeah. Just do it.
And I don't want to overwhelm folks because I just want to take a step back and say, we're all in crisis too, right? Our organizations are in crisis. We're worried about our staff. We're worried about our own families. We're trying to juggle. All of our staff are juggling. We're juggling. Our clients are juggling. But again, and maybe, Denise, if we could go to those questions just to remind everyone of, we want to talk about partnership resources, but I don't want to overwhelm folks because I do think you can prioritize and make decisions about what is the most important thing for me to be doing in this time around communications. But what I love to hear is that we're not forgetting about the fact that policies are being made right now, budgetary decisions are being made right now. And you all, I love this notion that, we're getting the calls in, we're tracking what people are asking for. That's a quick and dirty way of you going back out to a mayor or to a governor and say, I just want you to know of our, 300 calls, 20% of them are around food and just keeping the lights on. So please don't forget about that during this time. What you were saying about our child care centers or the rural child care centers can't be forgotten at this time. So again, this is why it's important to really think about who needs to hear from you, what your priorities are right now, and then how you're going to consistently kind of get that out there. I love that all of you were sharing your messages. I think that's super important. Again, some of you, it sounds like, had a plan in place already, but it's not too late. I just want to say that to folks. Don't get overwhelmed. It's not too late. Now is the time. Today is always the time. If you didn't do it before, today's the time to do it. So you can set those priorities based on your capacity, figure out what you have the capacity to do, prioritize who you're reaching out to, and then just consistently, I love, Tawny, you said we were going to over communicate. Just consistently get those messages out there based on what you need to share with people right now, and just do it, right? Just build that drumbeat, just do it consistently.
So I know we're coming up here at the top of the hour. We can go a little bit over, I believe, but I just want to make sure folks know that we do now have a new landing page for the resources. So we have videos that we referenced earlier. Sharon, I'd love to get your safety video that we can upload as well, perhaps, for people, or a link to it, so we can make sure folks see that. We can even have the pattern, perhaps, for the face mask patterns. I know a lot of places are asking for homemade masks at this point even. It's disturbing in our country that our hospitals have to have homemade masks, but this is what's happening. We are developing memes that are usable by local agencies. We know that fundraising isn't necessarily something that a lot of agencies necessarily have done. So we will be posting these easy to modify memes that you can use for toolkits. For your own Facebook post, your Twitter post, your Instagram, whatever the other postings might be. This is another one, and we're trying to do other ones that now really embrace the promise. We care about the entire community. We're really trying to help people help themselves and each other. And we're trying to sometimes use the social distancing, but also say more physical distancing, but social connectedness, right? That we're not about social isolation. We want to make sure people are staying socially connected. So these pieces will be out there and up on our website. So with that brief commercial, Ketayoun, I'll circle back here if you want to take a few moments with these questions.
Yeah, so I did hear a couple of you talk about your crisis teams. Let's see, I think, Tawny, you were talking about who's on your team, and you all have communications folks on staff, is that right? No, you don't. Tawny, you don't have a communications person on staff. So
No,
how are you making sure that you have that communications lens? Is that something that, it sounds like you have a background in communications. Yeah.
No, I don't have a background in communications, but I played one on TV once.
Okay. like a lot of us. Okay.
But
So,
I have been really fortunate to have a lot of people that I've been around that have backgrounds in communications, and I've learned a lot from that.
That's great. That's great.
So, yeah.
And it sounds like some of you, somebody mentioned they have some frontline workers on your crisis team. I think that's terrific. Because that's that notion of, just don't think about sort of the management or the executive team. Think about folks that are bringing another perspective that can really reflect back to you, what do we need to hear about right now? What's pressing? So I think that's terrific. In terms of your audiences, in terms of who needs to hear from you, we talked a little bit about policymakers. We talked about staff. Who's communicating with donors right now?
Yeah, we're communicating with donors, and we're reaching out to people that we haven't traditionally for funding. We've gone back to our utility companies and said, hey, we need some additional funding. We've gone to banks and said, this is what's going on. This is what we hear. This is our greatest need. This is how much we can use. We've gone to, of course, all of the foundations and just said, this is what's going on in the community, and this is the type of funding that we could use to really make an impact in people's lives. So we're not just going to our traditional sources, but we're thinking about those that are putting out the message that they're here. So anytime we get a message from a company that says, we're here to support the community, then we're coming back and saying, this is how you can support the community by partnering with us.
Mm-hmm. Yeah, I
same type thing.
Yeah, same time thing. I think folks feel a little hesitant sometimes in a time of crisis to think about that. But It's just an example for everyone that it is possible, and it is based on a real need and a real service that you're providing. So don't forget about the donors. Don't forget about the donors. I'm seeing that Marcy is saying, we send out a weekly agency-wide update to all our donors, the city, the county, the board, and the staff. I think that's terrific, really terrific. In terms of what you're focused on, if you had to summarize, what are the most important things that you're trying to communicate at this time? I'd love to hear from each of you, or also just in the chat box. What are the 4 or 5 main things you're trying to share? One of you did talk about, it's not our first crisis. We are here. We're going to be here, and we're in this together, which I think is great messaging frames. But just in terms of, what are your priorities right now about what you're trying to communicate right now? Why don't I'm going to just Tawny, and then Sharon, and then Katrina. Tawny, what are the main things that you're really trying to make sure you're consistently getting out there?
That base message, community action is open, community action is here, and that our goals are to help low-income people make it through this and the whole community to pull together, and that we also are intention to keep our staff economically whole and healthy. Those are our 3 points.
That's terrific. Sharon, how about you all?
Well, kind of the same thing as Tawny, but we're putting a little bit of a different spin on that. We want the entire community to know that we're here for you, because at any given time, you may not qualify for us right now, but maybe down the road. And maybe we need our partner, our connection in the community to come in. And so just making sure that safety is one of the main issues for us, but making sure that the entire community knows that community action is here. We're boots on the ground. If you've got an issue, we've got a solution. So come to us. We may not do it internally, but we certainly have a partnership and a friend that we can go to. And so those are the biggest things that we're working on, and we want to continue to push out during this time.
That's great. Katrina.
Yeah, those same things. And again, that calm, steady message that we've been here for 50 years, and so we know what to do. But then we also have another line that we've added is that we connect Northern Kentucky, because there's so many people right now that have never had that never needed any type of services. So like Sharon said, if you start here, we will connect you with whatever resources that you need. So many people that never even filed for unemployment, we can help you to do that. We can help with whatever service you need. We will connect you. So we connect Northern Kentuckians.
Mm-hmm. That's great. I see a few folks putting some things in the chat window as well. One thing I want to, available, reliable, we're steady, we're strong, we're a source of hope. There's, where to go, right? Like very factual things. How can you reach us? If all of our doors are closed, how is it that you can reach us? That's one of the most important things that you can tell people right now, right? How can you connect with our services right now?
And one thing that we did with our services to try to streamline it is we came up with one phone number, because as I said before, we're in 8 counties, so we have all these different numbers, but we have one phone number that if you call, we have 5 attendants on that, so you can get a live person, because so many times you can call and you need information now. So we wanted to say, if someone calls that's never called before, they need to talk to somebody and talk to a staff person that knows about everything in all the counties. So we were very strategic in the staff that we have that's answering those phone lines. So no matter what county they're in, they can answer that question. But there's one number anybody can call, and that number, we gave that to the unemployment office, to all of our community partners to say they can call this line. They will get a live person to help them with whatever situation they may be dealing with.
That's terrific. There was also a question in the chat that I just wanted to mention that you all or folks in the chat can answer as well, which is, what are you telling frontline food pantry staff that are scared they're going to be exposed to COVID? How are you keeping them safe and reassuring them?
A lot of conversations, just to be honest with you, and then streamlining and changing the way that we've normally done food service. We have everything boxed up now. Everyone has an appointment. We want to make sure that we're encouraging that social distancing. So when someone comes up, they don't even come in. We bring the box right out to them. In the past, they've been able to come in and select what it is that they want. We've had to, do things just a little bit differently. But, and people have those concerns. But when you take those extra precautions, have the same people working there every day, so everybody gets into a routine about who's sanitizing at this time, washing hands, wearing gloves, wearing face masks, doing all of that. It's when you change your routine is when things happen. Because we had conversations internally about, we'll do 3 people this week and 2 people, and switch off so it's fair. But sometimes fairness, whenever you're being fair, it doesn't seem like it's fair to other people. But having the same people so that they get into a routine and they know who's supposed to be doing what, and having those boxes being ready for people when they come. So even though our pantry now opens at 10 o'clock, our staff come in at 8 o'clock and they're getting all of these things ready. So all we're doing is walking out with that box, handing it to the car, and they're driving on. It's curbside service all the way.
Mm-hmm.
We've also extended the hours that our staff can do preparation work so that for some reason, in addition to asking them, what else can we do to help you feel more comfortable and safe doing this work and truly listening to their responses, there are several of our staff members that feel better coming in, say, from 7 to 8 at night to do preparation because it doesn't feel as busy or close as it might during the normal workday, even though there may be the same number of people.
Mm-hmm.
That's good.
And one of you said that there's a lot of, again, I just want to remind you that right now, nationwide, there's a lot of trusted employers right now. You're the number one trusted source, maybe other than Anthony Fauci, who I just, every time I listen to him, even if he says like, we're all going to die, I'm like, I feel so much more comfortable now, because it's coming from him. He's so reassuring. He's just consistent and reassuring, and I'm going to get straight talk from him and I can handle that, right? But other than him, I think employers are the number one trusted source of information. And you all said that there's just a lot of trust that if you're going to be straight and factual and say you're our number one priority and you really mean it, we're doing what we can do. You're listening to folks. Tawny, you were saying you're really listening and really responding. Then that's how you can be reassuring to folks when their anxiety raises up, and you're giving them factual things. Here's what we're doing to keep you safe. We changed our hours. We've done this. We've done that. You're telling them you've taken steps. You're letting them know what the steps are, and you're letting them know that you're really thinking and listening to them, right?
And I'm going to tell you what, another thing that goes a long way with staff, because let's just not pretend here. We're all a little anxious about this.
Absolutely.
Everybody. And so one thing that I do routinely every conference call, I call out people that are doing this hard work, and we all celebrate our staff. And it makes a difference when our staff know, one, that you might not be over there at that food pantry with them, but they're working their butts off and they're doing a good job for the community. And so and there are a lot of things going on, but giving staff some recognition for the work that they're doing, that has seemed to help some. Now, does it relieve all anxiety? No, it doesn't. But giving staff credit for the work that they're doing so that I want to make sure that I'm not complacent and not realize that sometimes my staff could feel alone if they're doing another task and we're not seeing as many people as we used to see and, all of that, to make sure that we're keeping grounded there. I think that's important.
And I just want to say, and this is something that I've been talking to some other agencies about as well, even though it's a crisis, all of your communications doesn't have to be about the crisis. I just want to point that out. It's still a good time to communicate. If you were showcasing volunteers and donors and staff for the great work that they've done for you on your social media, it's still a great time to do that. In fact, now more than ever, right? So folks are looking for hope right now. They're getting overwhelmed with anxiety, overwhelmed with fear. And so if you're giving them hope about take pictures of your food pantry workers handing out a box and say, we just love Darla and she has been terrific and we are so excited that she's part of our team and part of our response, right? People are looking for hope and just real life examples of the fact that we're still in this together, our community is marching forward, good things are happening. So I want you to not feel like everything is about the crisis, and that you can even just continue to put stories of hope out there, and that good things are still happening, right?
I'll tell you that
Somebody asked about remote. They were talking about remote staff, and so one thing I did just for fun is to say, send me pictures of you working remotely. So everybody's been sending in their pictures on the phone and, with their papers and doing notes. And then we're sending those out to everybody. And I'm just giving them a shout out saying, hey, I'm glad to see you're still engaged with Youth Field. Thank you for your work. And so that's been all these last couple of days, everybody's been sending that in. And staff are saying it's just good to see each other. So just a little easy thing to do.
Well, and we're also, we're using this as a time because we're still community action, right? That census is still important. So while we have all of our staff working from home, we're calling those daily check-ins. Have you received your census in the mail? Do you have your code? You want me to help you walk through it? Whatever we can do to get those done. And we're also going to use this as an opportunity to get people registered to vote. If you don't know how to, or you don't have the tools to do it at home, we're going to help you do that for you. And so making sure that people know that we believe you're important enough for us to talk to you about registering to vote. We believe you're valuable, so we want to make sure you're counting. And so still being community action.
That's terrific.
Dare I say that crosses over into the Census 2020. We know so many folks across the network were pushing out and still are pushing out Census 2020, but that get out the count.
Mm-hmm.
We really hope a year from now, 2 years from now, this country looks at issues facing vulnerable families who are struggling in different ways.
Mm-hmm.
We thought that might have happened after the recession. We thought that might have happened after Hurricane Katrina.
Yep.
But we really have an obligation to 2 years from now be talking about the struggles families face every day, and that people need to get counted now. So 2 years from now, that apportionment happens, that monies are coming into communities. So it's a weird kind of confluence of things happening right now.
Denise, I was on a local webcast recently with the Chamber of Commerce about the census, and the silence was deafening when I said a lot of the COVID resources that will be coming to our communities are going to be based on the census data that's already here and in existence, which just tells you how important it is and how it can be meaningful to our everyday lives. And the folks on the webinar with me were like, oh, wow. It really, it makes a huge difference, but that's one that's very timely to communicate.
Light bulb goes off.
Yep. Well, and that way too, it gets your mind off of the crisis that's going on right now, and it gives your staff an opportunity to talk to the parents or your participants about something other than fear. Let's give them some hope for what is going to be. And so it's a mood changer.
Yeah. Mm-hmm. I just want to say, somebody in the chat window talked about that they're also using this opportunity to send out lighthearted things, right? And so, one of the things that I've seen one office do is they've been asking everyone to send in a photo or an idea about what you're proud of today, or what do you consider a success today. And lots and lots of people were emailing pictures of toilet paper that they purchased. So, I think that's easy to translate to social media as well, right? What is one success that you had today? Some people are like, I showered today, I changed out of my pajamas. But it's a way to interject a little lightheartedness and a little bit of, we're kind of all in this together sense. So don't forget about those lighthearted moments. I think those are so important to us all right now.
Well, I just want to wrap us up here. I think we're probably a little over time, but I think the spirit of community action was apparent on all of your discussions here today. So thank you all for being with us. You guys are just doing amazing work in the field. The promise of community action stays with us all, and there's nothing we can't do if we're not doing it together. So staying open, right? A lot of folks we want to make sure that families still have access to services, and you guys are making it happen, and whatever we can do to be helpful in how you communicate that. And I will say the partnership is going to be deploying, I think, a couple of different ways that we can try to be helpful. But if we're not doing our job, you need to let me know so we can pivot and better meet your needs, because right now, as Lori said, is a moment. Now is our time. We have a window of opportunity to change the way people see and believe in community action, because right now, we are part of the essential service delivery system. We always have been, and we always will be. And now's our time to really show that. So thank you to our panelists. Thank you, Ketayoun. Thank you to everyone who was on here today. We're going to capture everything in the chat window as well, and keep an eye out for more information. So any last call, any of our panelists?
Just thank you so much. I'm inspired and in awe of all the work that you all do.
Community action, helping people, changing lives. All right, everybody. Thanks so much. Stay safe and know that we care about you. All right. Have a good day. Bye-bye.
Bye.